So, thank you very much for inviting me. Today I will present you the case of food security in Montreal and how the neighborhood governance and community response organized towards the pandemic. You can change. I will try to go quite fast to go through everything. So I will present 5 elements. The original, well, I will start with the original settings of what is going on as the community organizations and food security in Montreal before the pandemic. We already had the great organizations working. So I will present that, and then we'll see how the crisis impact these food emergency aid organizations and what was the regional local response to it. And then we'll see what's the role of governance and the community for a resilient food system. So we had a lot of people involved for food security in Montreal before the crisis at different levels. We had the provincial government with its regional public health department that was very active with supporting local organizations with funding and action plans and projects. And then we had the City of Montreal funding organizations too. We had the United Way with a lot of funding. It's the most important organization that was providing 50 millions a year. And but the most important, I would say, was Moisson Montréal, which is the regional food bank that was organizing already food redistribution from grocery stores and different inputs from food to the local community organizations. So they had 241 accredited organizations to whom they were delivering food. Then we have different levels of governance with the regional level, with the Montreal Food Policy Council, which I support through my work. And we had 30 neighborhoods community councils that were acting at the neighborhood level for collaborations between neighborhood community organizations. And then we had more than 600 local community organizations that were active, more or less active, depending, in Montreal. We can skip. So what happened on March 16, we had the confinement measures that were imposed by the provincial government. And then on March 28, we had an inter-regional movement restricted by the government. So these measures really put pressure on the food availability because one of the measures was the closure of the restaurants, bars, and cafes. So all the citizens were suddenly had no alternatives, and they had to go to the grocery stores. But it was still very hard because of the social distancing measures within the grocery stores. It was hard to access them. And then people were piling up a lot of food. So there was a momentary lack of food basics because of the just-in-time way of working in the grocery stores. And then we've seen we have a system that is called 211, which is like 911, but for community services. It's a community resource directory. And the calls for food aid really surged. We've seen that it was the most important reason for calling. The citizens were really calling there to know where to get emergency food aid more than anything else. And then, well, the local community organizations, many of them had to close because most of them they were working with elderly people as volunteers. So elderly people suddenly stayed home. There was a very big surge in demand for food aid, and there was a new increased need for delivery services. So many local community organizations closed because they had no more volunteers. Some of them suddenly started to do food aid. Some of them started to do deliveries. We can skip. So we can skip that. It was just to show how the food needs were important. So 5% of the Montrealers reported that they lacked food. And 43% of them reported that it was because of a lack of financial resources. But the most important thing is to understand that most of these 5% were not experiencing food insecurity before the crisis. So there was a surge of new people that needed food emergency aid. We can skip to the next. So as I said, there were different challenges to food security. We had an increased need for supplies. The local organization needed protection equipment, which they didn't have and was really difficult to access. There was a lack of volunteers, and then you had to deal with the social distancing measures. So they couldn't, even if there was a lot of volunteers ready to help, it was impossible to bring them in because of the, social distancing measures. There was an increased need for deliveries, and most of the organizations had not that capacity. And then there was the school closure, which ended the food aid programs for kids. So we had the children also needing food aid. We can skip. So there was a regional and local response. Very quickly at the regional level, many organizations, well, all the organizations that I've presented you at the very beginning, pulled themselves together. So institutions from the government, the philanthropic organizations and community partners pulled themselves together to try to understand what was going on. We needed to collect the data because we didn't know which organizations were actually functioning and delivering food aid to the people. And then we need to follow up with the challenges of these organizations. Who was experiencing what were their needs, so we could channel the right aid to them, whether it's human or financial aid. And we had to optimize the food distribution mechanism, and we tried to identify alternatives. There were many alternatives that were put up, and we tried to collaborate with different private sector, public sector, any actors that was able to help. We tried to coordinate new innovative responses. We can change. So there was many innovative responses by different actors. So we can see Montreal City start distributing free food to homeless people in 5 parks. The Montreal boroughs, the actual governmental institutions, started funding new funds for community organizations. And then many NGOs and local organizations started to work regionally. So for example, we have La Table des Chefs, who started to really coordinate a response and mobilize the restaurant chefs to provide meals to the needy. So 1.6 million meals were and are still cooked by volunteers, chefs at the moment. So many more initiatives were put up at the regional level. We can skip. There was also a very, very quick citizen responses. And as Maria Teresa mentioned, I think it's really important to mention the importance of social media and how it was a very great tool for citizen coordination and responses. So many mutual aid groups were put up, but mostly the one that you see here is the regional one, but every single neighborhood had their own group. So people could actually exchange information and provide help to each other. There is a very important group of cycling people who organized themselves very quickly and started to provide the delivery, food aid delivery for the community organizations. So this is still working now at the moment. And then we have a lot of artisanal protective face mask production that is providing the community organizations. Let's skip. So there are many risks related to the local food system. First, we mentioned it, there's a general dependency on imported food. And we've seen that the industrial agriculture sector here is very dependent on the foreign workers. So that's one of the pressure that hasn't been felt in the city, but we could see it in the outskirts. it hasn't impact our capacity to deliver food security in the city, but still it's an economical problem. And then small organic farmers, they were really impacted because the restaurants were their most important clients and they lost them in one day to the other. So there is a very strong need to improve their capacity for the local organic farmers and just local farmers in general to improve their capacity to access public spaces to sell their products. And then but still, citizens responded to the crisis in one way. Well, the wealthier citizens were started to really subscribe to local farming organic basket. Do I still have time, Camilo?
1 minute.
All right, perfect. And well, one need was, let's say, the needs that we need to do in Montreal, we need to provide funding to local community organizations as an essential service to the people, because we've seen that they were at the front line and the funding is really still not enough, even if it's great here. We need more communication and coordination. The coordination was great, but still there was a lack of relation between the regional level and the local level, and we tried to address that, but there's really a better way to do this with probably online platforms and maybe logistic tools, and really use technology a little bit more. And finally, we could have a urban agriculture plan for Montreal and greenhouses that would really provide during all year long way more very local products. So I have many things to say still, but this would wrap up my presentation.